Hello, myself Dr. Kripa. I'm a fertility specialist who is practicing in Lifeline Hospital based in Kochi and in Adoor. So today I thought I'll share with you all some of the common misconceptions and ideas pertaining to low sperm count and how we can deal with it once we come to know a couple is facing the issue of low sperm count. So, low sperm count has been a very distressing problem, and most of the men feel quite disheartened at receiving a report of low sperm count. Low sperm count can be sometimes be even a state of azoospermia, that is, absence of sperms in the semen. Or there could be multiple other problems also which men feel, like anejaculation or even aspermia, like absence of sperm, pertaining to different causes. So, not going into deep into the problems or the real causes of these problems, just having an overlook like how to proceed once we come to know that these people are having a low sperm count. So, the desired amount of sperms is something like 16 million per ml. That's the sperm concentration which is required. So, usually, if the couple have a concentration of sperm somewhere around 10 or 16, it sounds quite promising, and we can tell them that minor amount of treatment or interventions could be very helpful for these patients. Like we can give them tablets in the form of antioxidants, and some micronutrients and minerals can do a lot of difference for these patients. And also for these patients, we can try some lifestyle modifications like weight reduction, changing their working habits. Some of them might be working in very hot environment. All those things can benefit them. And also some surgical procedures like micro surgical procedures like varicocelectomy can also benefit some of these patients. So and also treatment modalities like IUI, that is intrauterine insemination, have also seen to benefit them. But for those patients with a count less than 10 million, we need to dive in a bit more deeper into what could be the causes, whether because when the count is too low, something like 1 or 2 million, or azoospermia, we might even have to go into the genetic basis of the disease, whether they are having any genetic problems which that has led to this azoospermia. Because if that's the case, again further evaluation and consultation with a genetist is quite important before retrieving the sperms for treatment like IVF. So a detailed evaluation and involvement of the genetist is of pivotal importance when we find to have the patient is having very low sperm count or even azoospermia. So some of the common misconceptions that people have is like if we have a very low sperm count, it's quite impossible to achieve a pregnancy. But I would say that is not the real situation, because with the advent of the new technologies, we have wonderful treatment like micro teaser, and also for those azoospermia patients where there is an obstruction in sperm to come out, they have a wonderful results, because just by normal aspiration from the epididymis, or the point where the semen gets collected before being put into the ejaculatory tract, a small needle aspiration could also yield a lot of sperms, and that could also give you wonderful results. So it's not the end all and end all of all the treatment if you find out that if you have azoospermia, definitely we have to go into details about what causes azoospermia or low sperm count, whether it's a testicular problem or just an obstruction. If it's an obstruction, definitely there are lots of means and the results are quite promising. But even for non-obstructive azoospermia also, this microTISA is a very promising treatment and has yielded wonderful results for those couples who once thought that that was the end all of all the treatment. And again, again a concept which people do have is like whether any treatment can boost their count from a zero count to a normal count. And that is even though there are no absolutes in medical medical science, we often tell the patients that our aim is not to boost the semen count from a 0 count to a 15 million, because there are no magical treatments or anything of that sort which can pump your count to such a extent. But our aim is whatever little we have, if it's a progressive testicular damage, whatever little sperm is left there, we have to prevent any oxidative damage to whatever is existing, and as soon as possible initiate the treatment and get out, take those sperms out for an IVF or an ICSI, that is an intracytoplasmic sperm injection. We have to retrieve whatever is left behind, and if it's whatever is causing the damage, if we can revert it, if it's a reversible damage, revert it, and then probably we can achieve a better result. So I have to tell those patients, because most of them, I feel, when they come to the OPD, they were given such false promises that there are medicines that can boost their count from 0 to 15 million or 16 million. And that is, I would say, most of the messages which we get or the news which we get from the internet, take it with a pinch of salt, and definitely meet a consultant and get to know check the facts which you are dealing with, because our aim is not to normalize your sperm count, but rather to achieve a pregnancy. So based on your problems, we can deal with it. And even if you are in a situation where we cannot improve your count, we can definitely look out for a treatment with which we can retrain whatever little sperms you have and go for a pregnancy. So I just want to conclude by telling that an azoospermia result or a low sperm count result should not dishearten you, because once you streamline the treatment, if we can prevent this from happening, or we can revert this process, definitely that will be looked out into. But if we cannot revert the damage which is already caused and we are left with a very low sperm count, definitely we do have treatment for that as well. We will try to retain whatever little you have, and we can proceed with the treatment. I hope this was helpful. Thank you.